I have cancer. I have cancer. I have cancer. I was walking around my house, saying it out loud, trying to get used to the idea. I didn't think I was frightened, but I wasn't paying attention. I thought, after 40 years as a nurse, I would deal with my own cancer diagnosis in the same way I had every other illness. I would step back, approach it clinically and analytically. 2 weeks after the confirmation of my diagnosis of lymphoma, I noticed my lower back was hurting. As it continued to get worse, I called my nurse navigator and asked if there was any possible physical reason for that to occur. She said there was no explanation for the pain. My nursing brain immediately kicked in. I remembered discussions in my nursing classes when we talked about the connection between emotional and physical responses, and thought, well, if there's nothing physical that is wrong, it must be emotional. I asked, can you refer me to a counselor? After a few referrals and conversations, it became clear that there was no counseling available at my cancer center at that time, and I would have to find someone in the community. I couldn't sit up, but I found a counselor who would be willing to visit me at home. When she arrived, I was curled up in pain like a giant shrimp on the couch. She asked me a lot of questions before she said, "Are you afraid of dying?" No, I wasn't. I just didn't think that was a possibility. When you describe yourself to others, what words do you use? Capable, kind, caring, strong, fun. Of those things, what would be the hardest to lose? When she asked that question, I thought about all the challenges I was facing. Not being able to drive or clean my house or take a shower, not having the energy to talk on the phone or even walk to the post office box a few minutes away. And I realized the hardest thing to give up was being capable. I was afraid of losing my independence, and until that moment, I didn't realize how important that was to me. I was the person others turned to for help. I wasn't the one who asked for it. By the third session, I was sitting up, and the pain was greatly diminished, even though I had not taken any medication. We reviewed everything from the last session before she asked, "How do you feel when other people ask you to help them?" "I feel good. I like helping others." "So how do you think other people feel when you ask them for help?" "I guess they would feel the same way." "Well then, maybe we could think about asking for help as a gift. By asking others to help you, you are giving them a gift." I hope that healthcare professionals will see the patient-reported outcomes as the patient's gift to them. The PROs show the healthcare professional how to help in a way that is most meaningful to the patient.